We have Dr. Dean Favot with us, who's a retired physician after 35 years. Dean, welcome to the show today.
Thank you, Robert. Nice to be here. Really nice to be here.
Very, very nice to be here.
Yes.
You tested positive for COVID-19. How are you and your family doing now?
Oh, now that I'm home and I'm okay, everybody's good. I've had my first test was positive. My two other tests were all negative. So I'm pretty well cured now.
It's good to be home with the family.
Oh my God, it's fantastic.
Excellent. So tell me, what were your symptoms, and when did you decide to go to the hospital?
My symptoms at first is I lost my taste buds. And I knew that was one of the signs. Not everybody gets it, but I lost my taste buds. And then my skin became very painful. Like every part of my skin, I couldn't even touch it. I'd take a shower with a towel and it was like sandpaper. So I said, that's a little bit weird. And he says, maybe this is another sign. Luckily, I wasn't working. I work a local clinic. So I had a few days off, like a week off. I said, well, maybe I'll just self-quarantine for this week. And then things just went downhill after that. Within 5 days, I started to get a little cough and short of breath. And I was being my usual stubborn self, and I'd say, okay, I'm okay. My wife, Juliana, wanted to take me to the hospital, and she had arranged with my Dr. John Minardi, who's at the hospital, to get me into the hospital. And I said, no, I'm okay. I says, give me a couple more hours. Well, within half an hour, my breathing just went like I stepped off a cliff. I just couldn't breathe. Really short of breath. And I just was starting to get a little bit confused. So she took me in. And that was pretty traumatic for the whole family, especially for her. Because once they drop you off at the front doors, you don't see each other again. So you don't know what's happening.
As a physician, you know a lot more than the general layman. How worried were you about it, knowing the seriousness of COVID-19?
Well, at first I was maybe a little bit foolishly cavalier about it. I mean, I worked 35 years in an emergency room. I never got sick. Never had a cold. If I had a cold, it lasted 2-3 days and then it was gone. So maybe I was a little cavalier about it at first. And I thought, well, okay, let me just quarantine here. Basically, if you're going to call your family doctor, he'd say the same thing to you. Stay home a couple weeks till things pass. So at first, it didn't really bother me. I said, okay, well, I'm not doing anything for the next week, and I'll just tell them I'll take the next week off from the clinic. Then when things where the breathing got short, then I was a little bit more concerned. But I was still stubborn enough to stay home until my wife almost had to drag me out of the house.
Tell us about the process of entering the hospital, and then the decisions by the doctors to bring you to ICU.
Well, my wife dropped me off in front, and she wasn't allowed to go in. Luckily, Dr. Minardi was working that day, and she had communicated that we were coming in. And I walked in the door, and he looked at me, and he says, "What happened to you?" He says, "You look like hell." And I said, "I just can't breathe." He says, "You think?" He says, "You're great." He says, "You look horrible." I told him he had to work on his bedside manner. So then they put me into a private room that they had been using for COVID patients. And they got blood work and tests like that. And I hadn't been eating that well over the prior few days because I just didn't feel like it. You get short of breath. You're just not in the mood to eat. So they hydrated me up a little bit, and I started to feel a little bit better. But then still couldn't breathe properly. And so they kept me. They said, well, we're going to put you upstairs. They put me into a room upstairs first. But over that next couple of days, it was like I stepped off a cliff. I was amazed how quickly it happened.
Tell us a bit about how you were placed. I believe you were placed on a ventilator and intubated. How was that process? Well,
I got upstairs to the room, and I was there for a day or two, and then I started getting confused. And when you don't get enough oxygen, you start to get a little confused. So I was getting confused. And I actually requested that be intubated, to be vented. And they said, well, you're a patient. You can't make these orders, to have yourself ventilated. And I says, I just can't breathe. They said, this is crazy. And then I started to get more and more confused. And then they said, then they moved me from there to the ICU, where I was then vented.
So while you were vented, how long were you in the ICU, and were you conscious at the time?
Just before they actually vented me, for maybe the 12, 18 hours, I was so confused, didn't know where I was. Then they brought me into the ICU and they vented me. I was on the vent for about 10 days. And the ICU doctor, Dr. Eli Malice, who was phenomenal, and all the staff up there, he said, you're lucky you're in relatively good shape, he said, because with your chest x-ray and age, you have about an 80% mortality. So I go, oh, I'm glad you told me this afterwards. But then they said that we're going to have to tube you. And I don't even remember that part. And then, so I was on the vent for 10 days. And then the next day when they took me off the vent, I was still a little bit out of it, but coming around more and more. I sort of had it easy. My wife at home, who was going, turning gray because I was just laying there. I didn't know what was going on. You're on a vent, you're sedated, you're taking a nap. So.
Yeah, I was going to ask, how difficult was it for your wife and your family to, she drops you off and then, was she in contact with the hospital, or did they contact her? Or?
Oh, she was in contact with Dr. Malice and the nurses up there, nonstop. And he even gave her his personal phone number, call me anytime, I'll update you daily. Basically what happened, she drops me off in front of the hospital, and she never saw me again for 3 weeks. She said she pulled over and just started crying her head off because she wasn't sure what was going to happen. She contacted my sons and my sister, and it was just a traumatic experience for them. You can imagine what they went through.
Yeah, that's extremely difficult. What was, when you finally woke up after being taken off the ventilator, how long did it take you before you I don't want to say become normal, but you get your senses back, in the sense, because you said you were a bit confused?
Oh yeah, it took about a good day, but I couldn't even stand beside the bed. That's how weak you've become, laying there in bed in an ICU unit. It takes, they say it takes anywhere about 5 days for every 1 day that you're in an ICU bed to get your strength back. So I couldn't hardly stand beside the bed. Tried to grab a glass of water and my hands were shaking. I didn't even know where my mouth was. And so it took a good day or so before things started to come around. And, I'd be saying to myself, well, this is ridiculous. What do you mean you can't pick up that glass? But it's amazing how weak you become.
How appreciative are you of the doctors and the nurses and everyone over at Windsor Regional Hospital?
Oh my God, Dr. Eli Malice and the ICU staff up there. I can't say enough about them. They were phenomenal, just phenomenal. The emerge staff, everybody was just the best.
It gives you a different perspective, doesn't it? After being an ER doctor for all that time and helping people, and now here you are being helped by them.
Yeah, I don't like being a patient. I'd rather be on the other side. But the care was great and just phenomenal. And I don't think it's because I'm a physician. I think that puts a lot of stress on everybody. It's just, that's what they do. That's their job. They do it well. They work as a team. They were phenomenal. Just great.
Yeah, and you know, everyone's trying to, you know, give our appreciation to the healthcare workers, and I say we shouldn't do it just now. We should do it all the time because they're always there for us.
Yeah, the Windsor Regional Let Campus and Metropolitan Campuses. I mean, the staff there is phenomenal. These frontline people are, you know, they're fine-tuned. They know what they're doing, and they do it very, very well. And I'm not saying that because I worked there for 35 years. But they are like family to me because I knew them all.
Yeah.
But, you know, when something comes through the door, everybody knows their job and they do it extremely well.
This is a little bit difficult, but how emotional was it when you left the hospital? I saw you coming out of the elevator. We've got that footage. And the staff cheering, and then also finally seeing your wife outside.
Even now I get emotional about it. It's just such a great feeling. And, you know, my poor wife I hadn't seen her in almost a month, well, 3 weeks. And it was just a very moving moment. I don't want to ever have to put them through that again.
It's like I said, it's very emotional to go through that, and you know, we wish no one has to go through it, but you know, I think we have to let people know, you know, what is going on. I just wanted to bring up also that you also received another surprise when you got home.
Oh, when I got home, God, we turned the corner coming down our street here, and it was lined with cars on both sides. And I'm going, what's this? What's going on around here? And then I saw her cousins on the corner, my wife's cousins, my cousins, and then I see friends of mine all on the street and other cousins and family members. I'm going, oh my God. It took me a few minutes. I was like a deer in a headlight. And then going all the way down the street, it brings tears to your eyes, because these are just great people who, through their prayers and support, I think that's what got me through this. I have my neighbors, and you know, the mosque is over here, and they would tell me that, you know, even though they're Muslim, not even though they're Muslim, and they'd say they pray for me 5 times a day. And I said, oh my God, you guys, geez, that's unbelievable. I mean, the community in this area is just phenomenal, just phenomenal.
How are you, you know, your lung capacity now, where are you at, and any permanent damage to your body?
I'm feeling pretty good. My oxygen saturations are around the 95, which is where they probably should be. They tell me it's going to take a couple of months for my lungs to get back to normal. So I do get a little bit winded if I exert myself too much. So, and my legs are still pretty weak in my arms and stuff. But I'm a gardening guy, so they tell me to take walks, but I prefer to be in the garden and work out there, and that's my form of therapy. And so it's going to take a little time. I can't get anything because I'm COVID negative now. I'm fine. I do wear a mask over the next, I'll wear a mask over the next couple of months, only because my lungs, I don't know where they're going to be in the next couple of months. We've got x-rays lined up and stuff like that to see how my lung capacity is going to be. But for the most part, I feel really good. How's
your appetite?
Oh, great. Got my taste buds back. That's amazing. You know, being Italian, we want to be able to taste our food. I even had a glass of wine the other night the first time. I go, oh, okay. And it was a good bottle, because I said, well, if something would have happened to me, my kids would be drinking all my good bottles of wine, so I might as well start drinking them.
Getting a little serious here as we're ending up. Some people, they look at the numbers and they know it's not going to be me, and they don't want to wear a mask, or, you know, the whole social distancing. A lot of people are following it. There's some that don't. Advice to the community, having gone through it.
I know, with the nice weather outside, everybody wants to, or is eager to get out there and forget about everything and just go back to where we were before. I really caution against that. We don't want to get a second bout of this. So wear the mask, do the social distancing, wash your hands. Ford and Dr. Tam and stuff, they have a plan to open up the province, the cities. And it's going to be a little bit at a time, but continue to social distance, wear a mask in public. We don't want to get this again because it could come back. There's still hot spots in the province. Look at Brazil right now. You got Brazil and Russia, opposite ends of the world. And they have hot spot. They're going through mass infections. So we don't want to get this a second time because it will be devastating. So I really wish that, follow the guidelines. They'll open things up a little bit at a time. And I understand businesses and we all need a haircut but they'll open them up slowly and but follow the guidelines. That's what they're there for, and protect yourself. And I would continue to do that for the next month or 2 or 3. I would go beyond what they tell you, even in the guidelines. Go the extra month, because we really have to watch that we don't get a second wave of the COVID.
Well, it's always better to err on the side of caution, I feel, and I think you used the perfect word. We can't be cavalier about this. This is extremely serious.
It kills people. I was fortunate enough, but there's over 50 in our community that have passed from this. And there's still a few that are fighting for their lives in the intensive care unit as we speak. So we can't just throw caution to the wind and say, oh, we're better. And I know a lot of these guys are, in their 20s and 30s and these young kids. Well, you can get this. And the other concern is you can be a vector. You can pass this on to your mother, your father, your grandmother, grandparents. So stay, do the precautions, and hopefully everything will just gradually settle down and we won't get a second wave of this.
Well, I always try and end on a hopeful note. What are you looking forward to once this pandemic is over?
To be able to see my family and friends. They've been so supportive with their prayers and their support for my wife and family. I got to see my friends and family. I said they've been so good, just phenomenal.
Got to have a big family meal, right?
Get together. You know how us Italians are. We like to have everybody around. So it'll still be a lot of spacing, but at least we'll be able to get together and enjoy each other's company.
After all your years at the emergency room, I know that you took care of my son years ago. So I'm glad that you're up and at it. And thank you for telling us about your story and warning the public that, hey, we still got to be careful out there.
Thank you, Robert. And I'd just like to throw a little extra out there to Dr. Eli Malice and the staff, the intensive care staff and the emergency room staff. They were just phenomenal, just great people.
Well, thanks, Dr. Favot. Please stay safe and stay well.
You too, Robert. Thank you.